Hi, I'm your host, Mark Aaron, and welcome to In Focus by U Multicultural, where we focus on civic issues here in Winnipeg. And in today's episode, we'll be talking to End Homelessness Winnipeg on how COVID-19 affected the homeless people of Winnipeg. With me right now is Kristiana Clemens. Kristiana, how are you doing today?
I'm well, thank you.
So, can you tell us give us a brief description about yourself?
I'm the Manager of Communications and Community Relations with End Homelessness Winnipeg. In this role, I do a lot of community engagement work and media relations and updates. I help to design images and communications for the organization. And I also co-chair some different collaborative tables, such as our extreme weather response, which brings providers together to protect the health and safety of people experiencing homelessness during extreme weather periods, and the unsheltered strategy, which brings providers and government representatives together to collaborate on supports for people who are experiencing homelessness and not accessing the emergency shelter system.
So, can you give us what is End Homelessness for the people that are listening and don't know what it is?
Absolutely. End Homelessness Winnipeg was created in 2015 to support implementation of the 10-year plan to end homelessness in Winnipeg. So the 10-year plan to end homelessness was launched in 2014 following 2 years of community engagement and consultation. And that plan, in part, recommended creating a backbone organization that would work on a collective impact model to help guide Winnipeg towards preventing and ending homelessness. So, End Homelessness Winnipeg was created the following year with that mandate. And we partner with agencies across the homeless serving sector and with all levels of government, including Indigenous governance, and with the private and charitable sectors as well, to help align strategies and resources to make the shift in our community from managing homelessness through emergency and crisis responses to ending it through long-term solutions like housing, homelessness prevention, and person-centered supports.
So when COVID-19 first hit, what was going through your mind? With all the impact that COVID-19 will have such a huge effect in communities today.
Well, it was frightening to hear the early reports about how devastating this virus could be and how contagious it could be. So, End Homelessness Winnipeg pulled together a COVID-19 response, again, bringing together providers from homeless serving agencies with healthcare and government and funders to kind of strategize how we can work together to protect the health and safety of those experiencing homelessness. We know now that people experiencing homelessness are identified as at high risk of severe outcomes to COVID-19. And we've also seen the virus have devastating effects on people experiencing homelessness in other major Canadian cities. We didn't know all this back then, but what we did know was that this was a dangerous virus and it could have a real serious impact on the people that we serve. So we put in place a COVID-19 response plan for Winnipeg that involved setting up a testing site near adult emergency shelters at Thunderbird House. It involved creating a range of alternative isolation accommodations that are operated by one of the emergency shelters, Main Street Project, with the WRHA. And the purpose of these was to give people who had been tested or tested positive of COVID a place of their own to safely isolate and experience their quarantine time, knowing that they would not have housing that most of us might take for granted to be able to do that safely. The plan also involved expanding outreach services so that there could be additional outreach teams going out in the community and engaging with people on their health and safety and basic needs and connecting them to appropriate resources. And it involved developing a whole robust set of guidelines for people that provide services at drop-ins and at shelters
Mhm.
on how to prevent and mitigate transmission of COVID-19. So all of this planning work took place right off the hop, starting in March when we first went into some COVID restrictions. And this response plan has kind of continued to adapt and shift as the pandemic has evolved. Starting in late summer, we started to recognize that a lot of agencies had adapted services by delivering services outside. And that, of course, this would be a real danger in the winter weather in the context of COVID, because people are susceptible to frostbite, hypothermia, illnesses related to exposure to the cold. So we knew we had to create additional drop-in spaces and shelter capacity to try to accommodate that need, and also that outreach would be really important to connecting with people while they're outside to help try and prevent a real crisis of cold exposure among people experiencing homelessness this winter. And we also saw in the fall that a lot of agencies were facing pretty serious staffing pressures due to individuals being close contacts of cases and having to isolate and take time off unexpectedly to adhere to public health guidelines. So the plan also created a shared staffing pool that agencies could draw on for temporary or permanent staff as needed. So there's been a lot of innovations and adaptations to try and help address the COVID crisis in the community. Obviously, it hasn't been perfect, and I think what we're realizing is one of the biggest gaps, which is a bit beyond the scope of what our group could accomplish in this time period, but one of the biggest gaps is the lack of low barrier, low income housing for people, which makes it really impossible for many individuals to follow public health orders to stay home, and can also pose barriers to some of the other basic fundamentals, like being able to wash or sanitize your hands regularly, having access to masks, or being able to physically distance from others. So, we've done a lot of work together, and that's been reflected in lower case rates of COVID-19. Compared to many other cities, we haven't had any major outbreaks within our shelter and drop-in systems, which if you look at the news, you'll see is remarkable given the scale of outbreaks in Montreal, Ottawa, Toronto, Hamilton, Windsor, Edmonton. So things could have been much worse for our city, especially when we had very high rates of community transmission and daily case numbers. The plan has helped to definitely create a safer environment, but the barriers that exist in Winnipeg right now around low income and affordable housing, permanent housing options for people, are really kind of becoming clearly the biggest barrier people face to being able to safely make it through the pandemic and the winter months.
So with the COVID-19, did your company notice like that there's been more awareness and like an increased number of homeless people in Winnipeg because of all the limited shelters and people losing their jobs as well?
So we haven't actually seen any measurable increase in people experiencing homelessness, but what we have seen is that homelessness is a lot more visible. So in pre-COVID times, it's standard for there to be a significant number of people in a community experiencing what's called hidden homelessness. And these people are kind of moving from place to place, staying with family or friends, or staying overnight at the location of a party, maybe occasionally pulling money together to get a hotel room. A lot of those kinds of options in the pandemic obviously were right off the table because so many places were closed and individuals were told not to invite others into their homes, and that within their homes they need to maintain physical distance. So all of these people who were experiencing homelessness already but had access to temporary places to sleep or crash or go during the day, libraries, community centers also shut down in the lockdown periods in our city. All these individuals are suddenly outdoors and they have fewer and further between places to go to access services. And so in the summer months, we saw a seeming increase in the number of individuals in encampments. And then this winter, we've seen a visible increase in the number of people sheltering or gathering in bus shelters. So things have changed. It doesn't necessarily reflect an increase in the overall numbers of people experiencing homelessness, but research has been going into what the long-term outcomes of this pandemic will be. as you mentioned, the income loss and the sort of ending of benefits programs. And so, there is concern that the impacts of the pandemic on homelessness will really become increasingly apparent over the next 3 to 5 years. So we're really just at the beginning of seeing what the impact of this pandemic will be on homelessness in Winnipeg.
And how are you guys helping these people during these difficult times while following all the COVID-19 guidelines and restrictions? Because like you said, like shelter homes and other places are not allowing people to come in and stuff.
Well, so the COVID response plan and the extreme weather response plan recognized the challenges going into the winter months and actually um, did kind of evaluate capacity across the systems and create new spaces, daytime drop-ins, overnight safe spaces. Other initiatives in the community started up, and End Homelessness Winnipeg and other funders were able to support them to continue. So compared to previous winters, the homeless serving sector in Winnipeg actually has had this winter an unprecedented level of capacity. And we've only seen 2 of maybe a dozen of the shelters and safe spaces for adults and youth reach capacity this winter. So there's actually a lot of space within that system. However, people do have fears and barriers to going to access these spaces. When we hear about these large-scale outbreaks in the shelter system in other cities, we hear about how people experiencing homelessness are vulnerable to much more severe outcomes and higher rates of death due to COVID-19. Anyone hearing that news while living without a home might then be afraid or reluctant to go into a shelter or a drop-in space, even if it is being run with physical distancing, with masks and sanitizing in place, and having very robust measures to protect the safety of people accessing these services. And so what we've seen is that individuals experiencing homelessness in some cases are choosing to really limit the amount of time that they spend indoors because they're afraid of catching COVID-19, even though we have safety measures in place and room within the system to accommodate them.
So how can the Winnipeg community help and support like the homeless people, even though it's really hard for them to support each other because of the COVID?
The fundamental thing is just to recognize that these are human beings and to not make assumptions. People experiencing homelessness face a wide range of stigma and stereotypes that don't always reflect reality. So withholding judgment and just being respectful and compassionate towards our fellow human beings in the city is the most important thing. In the context of winter weather, the risks of frostbite and hypothermia, which can be deadly, are escalated quite significantly. So in cold weather, it's especially important if you see someone who appears to be struggling or in distress to really connect with them and make sure they're all right. Know where people can go to warm up and access services, know who to call, know when it's important to call 911 in an emergency situation to get medical service on site. So those are some basic things. People can also, if they're going outside, carry with them small items to distribute that are often welcomed by people. These might include energy bars, insulated beverage containers, socks, toques, masks, gift cards for coffee or groceries. All of these things are often very welcomed by individuals experiencing homelessness. People can also consider supporting an agency that delivers direct services to people who are homeless. So the emergency shelters and drop-in spaces that do exist often need donations of items or welcome monetary donations as well. But ultimately, we do get back to the major barrier in our local response being access to housing and the critical gaps in Winnipeg's housing continuum that have emerged over decades and really need to be addressed if we're going to end homelessness. And that involves connecting with your elected representatives in government at all levels and urging them to invest in the types of housing Winnipeg needs, which we know is low-income housing for individuals and for people with large families. And
All right.
low barrier housing and housing that can support people that have different kinds of challenges. We know that there's higher rates of many different kinds of disabilities in the community of those experiencing homelessness. And we know that some communities are disproportionately impacted by homelessness, such as Indigenous people. So encouraging governments to invest in approaches that will be inclusive and reflective of Indigenous people and people with disabilities is so important.
Well, thank you so much for your time, Kristiana.
You're welcome. Thank you.
Well, that's it for today's episode of In Focus by U Multicultural. I'm your host, Mark Aaron, and special thank you to End Homelessness for the time. Hope you stay safe and have a nice day.